My name's Kelly Fitzpatrick, and I grew up in a small town in Virginia and joined the military in 1999, and then didn't know what I wanted to do. I wanted to be an infantry officer first, and then I changed my mind last minute and decided to be a doctor. I worked through UMC over the last couple of years, off and on, taking care of trauma patients, taking care of people that really need help, and I felt UMC does a good job, so I wanted to join them. I didn't know exactly what I wanted to do when I went to medicine. I thought maybe I wanted to be an emergency room physician, even endocrinology at one point. But what really drove me to orthopedics is instant gratification, to be honest. Fix a broken bone and you see the x-ray and you know you've done a good job to get that patient back on their feet, moving again. And I feel like the outcomes with that were gratifying to me, and I felt like I made a big impact. I try to treat the patient like they were my family member. So if I were having a patient come and they were unsure of what they wanted to do, I would say, if you were my mother or my brother or sister, this is what I'd tell you. And I try to push that philosophy on my patients and my practice. UMC does a good job of taking care of the patient and not looking at the bottom line in terms of how much money are we going to make off this patient. And that is one thing that drives me crazy in medicine, is sometimes patients are looked at as a dollar sign, and I felt UMC does not do that at all. And they number one priority is taking care of the patient, and that is what drove me to take a position with UMC.